Here we are on page 1026. It's part 4 of the male reproductive system. And we'll be pressing on to the female reproductive system pretty soon, but we have a few more pages to go here, beginning with semen. And this completes the anatomical portions. We'll be moving on to the physiological aspects pretty soon. There's some more anatomical things to consider, and actually the structure of sperm itself. Right now, taking a look here at semen, we have the collection of all of the various fluids from the seminal vesicle, the prostate. There's testicular fluid, which accounts for a small amount. The sperm count usually is somewhere in the hundreds of millions, 100 to 400 million, somewhere in that range. They indicate here that fructose is going to be metabolized by the sperm, and so they'll be getting their ATP synthesis requirements from that. You'll notice that when we look at sperm, eventually there is a section called the next section right behind the head that is actually constructed by just mitochondria, and so it's almost like having an engine right there on the in the midsection of the sperm. You can take a look here at these contents and note what's there, and we'll press on then to the next section. Just as a side note here, notice that it has somewhat of a range of pH possibilities. It prefers a range probably somewhere in a buffered region of 7.4, but it will function within a range. Okay, and they talk here about the number of sperm per milliliter, but then there's usually a couple of milliliters, 2 to 3 milliliters, they say. 2 to 5, but if you were to consider maybe 100 million per milliliter, that can be quite a lot. Okay, then we press on here to the physiological system, and we're going to be looking at the male sexual response, and there is both physiological aspects of it, behavioral aspects of it, and historically textbooks tend to omit stage 3. They usually go for stage 1 and stage 2, and this is a biology text, and like biology or medical texts, this is the same. They don't actually list a third stage here, but I do, because Dr. Elaine Merib, who is the author of the book, does include this extra paragraph here, thank goodness, so that I can be complete. This is one of the features that might make a woman more likely to include this is the very fact that women have estrogen in their bloodstream. And so I will take a moment here to distinguish between genders in this particular way, that without estrogen, oxytocin only has receptors in the central nervous system for the most part. With estrogen, there are oxytocin receptors on smooth muscle associated with the breasts and with the uterus, and possibly other portions of the pelvic region. And so that just means that when this stage comes about, and it could come about just in terms of any, how shall I say, desire to feel the sense of cuddle or to concern for a loved one of any kind, that women are likely to feel a twinge, an actual muscle twinge, in the breasts and possibly in the uterus. There was a woman who mentioned to me that she feels when her child is taking a risky chance with some activity, that she feels a twinge in her uterus. So that at any rate, oxytocin is a molecule that not only activates emotions in the central nervous system, but it also binds to receptors on smooth muscle and causes milk letdown in the breasts, and also has an effect on the uterus. quite a number of times, not just during childbirth. Okay, so I wanted to bring that to your attention, and the reason why I'm really bringing about these 3 stages. So let's take a look here at erection. Is listed here as this parasympathetic stage. Also, by the way, we're doing parasympathetic, sympathetic, and then parasympathetic, in this rare sort of moment of human physiology where the autonomic nervous system is not at odds with itself, that this is a cooperative moment in the autonomic nervous system. So that's an important point. Nature wants babies, and so it makes the arrangement for sort of the prime directive here to become accomplished. Okay, so one of the things that we'll notice about this first stage is the release of nitric oxide. We've seen this before. Endothelial nitric oxide is an important part of nighttime sleep with regard to growth hormone and liver growth factors. In the repair of the body at the most minute levels, is we can, how shall I say, repair and make better the endothelial matrix wherever capillaries exist to nourish cells. Okay, so that we can improve, remove glycosylation, as it were, and improve the flow-through of nutrients and waste products. So nourish and clean the cells is part of the nitric oxide mission. In this case, it's there to open the passageways and to stimulate and arouse and allow for expansion in the erectile tissues. Blood will move in. It'll be engorgement. Okay, so that's part of the program. There's also an aspect in which we're stimulating the bulbourethral glands, and they're going to secrete their alkaline fluid to sort of clean the passageways in preparation for this next stage, which is ejaculation. This is the sympathetic stage then that comes about at the end of the arousal stage. And the sympathetic stage in this case is using L1 to L2 portions for the direct sort of hardwiring, but I would, how would I say, I would warn you that sympathetic is actually a full body experience, because more than 50% of any sympathetic outflow is bloodborne from the medulla of the adrenal gland. So that needs to be understood, that there is not just simply a hardwired situation, but that there is also a full body response. And it probably includes significant parts of the CNS as well as the physical nature of things. The bladder sphincter closes so that the semen does not go retrograde into the bladder. It goes forward through the urethra, from the prostatic urethra, and then out through the spongy urethra. And so they are describing here all of the accessory glands are going to contract, and there's going to be emptying of the contents into the urethra. It says then the semen in the urethra triggers a spinal reflex at that point, and that there is further types of contraction and propulsion that goes on. And you can see here the velocity at which the sperm makes progress through that system. And then finally we do get to the resolution portion, and the male felt, as you would imagine, not as intensely as the female will experience it, because this is a period of oxytocin outflow. And so the stage 3 here is parasympathetic. It's a recovery period, and whereas one individual might be resting, another individual might actually be experiencing some fairly significant events, shall we say, both physiologically and psychologically. So a good moment to take a moment to bond. Okay, so then we'll talk more here in this next section about certain levels of dysfunction.